Immigrant workforce. A vital component of U.S. healthcare. America's aging population and increasing healthcare demands are heavily reliant on the contributions of foreign-born workers. Yet current immigration policies create systemic barriers to attracting and retaining these critical professionals. Nearly 20% of the U.S. healthcare workforce, including physicians, nurses, pharmacists, and home health aides, is comprised of immigrants. This dependence is not merely numerical. It extends to innovation, research, and accessibility of care, particularly for the elderly. The scope of immigrant contribution. The role of immigrants isn't limited to direct patient care. They also drive progress in biomedical research and education. Almost 19% of healthcare workers in the U.S. are foreign-born, with specific roles showing even higher dependency. Home health aides. 41% are immigrants' personal care aides. 28% are immigrants' physicians and surgeons. 26% are immigrants. The reliance extends to scientific advancement. Roughly one-third of Nobel laureates in medicine since 2000 and over 40% of chemistry laureates are immigrants. Almost half of bioengineers, biomedical engineers, and medical scientists working in the U.S. were born abroad. Foreign-born researchers are also more likely to hold Ph.D.s, 57% versus 26% for U.S.-born, and engage in patent-worthy research, 92% versus 83%. Impact on accessibility and independence. Immigrant workers impact healthcare accessibility by helping older Americans age in place rather than in institutions. A 10% increase in the less educated immigrant population in an area reduces nursing home admissions by as much as 29% for those 65 plus and 26% for those 80 plus. This effect is significant because it eases strain on institutional care systems while improving quality of life for seniors. Policy barriers and calls for reform. Despite the clear need, the U.S. immigration system lacks dedicated pathways for healthcare workers. There are no temporary visas specifically for nurses or home health aides, and annual H-1B visa limits leave many qualified professionals stranded. Individuals from high-demand countries like India can face decades-long waits for permanent residency, green cards. Legislators recognize the problem. Senator Alex Padilla, DCA, states, "Immigrants drive innovation, perform highly skilled procedures, and provide critical care." Representative Bill Foster, DL, adds, "We turn away international STEM students who want to stay and contribute." Bipartisan efforts, such as the Keep STEM Talent Act, Foster and Lawler, propose allowing STEM graduates with job offers to bypass numerical immigration limits. Former Health and Human Services Secretary Tom Price also advocates for retaining U.S.-trained international workers to address shortages in elder care, rural health, and chronic disease management. The many contributions of foreign-born workers to healthcare delivery and infrastructure in the United States are particularly remarkable given that the country does not have any visa categories reserved for healthcare workers. Madeline Zavodny, the current system creates artificial scarcity in a field where demand only increases. The U.S. must adapt its policies to reflect the reality that immigrant healthcare workers are not just a supplement to the workforce, but an integral part of it. The future of U.S. healthcare depends on recognizing and accommodating the critical role immigrants play in delivering care, driving innovation, and ensuring access for a growing and aging population.